Microfilaria in the intermediate host goes into the several stages and finally reach to the salivary gland of the vector and the B. milli, morphologically similar to the Vashula bancrofti, but it is smaller than Vashula bancrofti. Microfilaria of B. milli contain the single nucleus in the tail tip, while the Vashula bancrofti does not have it. And B. timuri does not stain pink in the Giemsa stain. The rest of all are stained pink in Giemsa stain. Infection occur in the man through the infective mosquito bite and cause the disease called the filariasis, fever, lymphadenitis, and hydrosol elephantiasis, hypereosinophilia. It is not the primary prognostic marker. The diagnosis of filariasis is made by the blood taken on the appropriate time and sometime also detected in the urinary deposit and serological test, and specific antibodies in the several serum using the larva antigen can also be done. Toxocara species, Toxocara ticinus and ticati are roundworms of the cat and the dog, and the fox is similar to the human worms but are smaller. And the ticinati and cervical eli is relatively more wide and straight. Infection in the human occur by the ingestion of the eggs but cannot settle in the intestine as in their definitive host. The ticinus causes the eye blindness in the human. It's also called visual larva margin. And the various clinical manifestations are hepatomegaly and persistent hydroeosinophilia and bronchial asthma fever. And this is also called visceral larva margin or ocular larva margin. And Vigestrin disease and Fremont Moller syndrome are eosinophilic pseudoleukemia. Diagnosis is made by the serological identification, and sources are soil, fresh or unwashed vegetables. Capillary hepatica is also helminthes. It's liver disease they cause and the parasite of the rodent basically, but morphologically it is much close to the trichoria species, and infection the liver parenchyma and remain until the liver is damaged completely, the host is dead. The diagnosis of the parasite is made by the detection of egg of the liver biopsy in most reliable. And the capillary Philippines can violent diarrhea cause the violent diarrhea and diagnosis by detecting the characteristic egg in the feces. And the egg swallowed by the predator host but cannot cause the infection and pass through the feces. Upon releasing to the soil, the embryonisation takes place and become infective, and infection takes place by the ingestion of the embryo egg and hatch the larva into the migrant to the liver and to develop into the adult worm. The presence of the adult worm and its eggs cause the damage of liver cells and leading to the abnormal liver function, LFTs. Angiostrongylus caninus is its common name is rat lung worms, and it's roundworms, and its element is its delicate nematode. And the male and female worm are of the same size, intermediate host. It does not cause the disease because hatch the larva curve up to the trachea and are swallowed, finally passing the feces. In the freshwater, the land scrub or coconut scrubs serve as a reservoir. The larva is ingested by the definitive host, which migrate to the brain and lungs and develop into the adult worm and cause the infection. The infection in the man takes place by the ingestion of a larva by eating the intermediate snail host, Acantana fleca. Mainly cause the eosinophilic meningoencephalitis, headache, stiffness of the neck, and diagnosis is difficult, but the eosinophilic pilostosis of CSF and the positive immunological diagnosis of Angiostrongylus caninus antigen, and which is used to detect this organism. This is basically from the snail and scrubs. By eating the snail and scrubs, it's a roundworm, and the rat lungs worm. The second organism to the Naegleria that cause the meningitis. Trichinella spiralis is a pokeworm. Trichinella spiralis is smallest nematode to infect the man. Female are bigger than men, about 1/2 times, which is 0.5 mm to 3 mm. The unique aspect of this parasite is a single animal serve as both intermediate and definitive host. Once the infected juvenilia grow into the adult form, fertilized female worms start give birth to the juvenilia and pass into the feces, migrate to the liver through the portal vein. It causes trichinosis, which is the gold standard test for detection of cognitive muscle biopsy. When gingula are migrated to the liver, it's reached to the skeletal muscle like eyes, tongue, diaphragm, where it become encysted. Humans are infected by consuming the raw meat of the pig, uncooked meat of the pig, food poisoning like symptoms like in adult form. Migration of larva causes the muscular pain, muscular paralysis. Larva goes encysted and causes the toxemia like symptoms. Diagnosis is made by the encysted larva in the biopsy immunological test, xenodiagnosis technique by feeding the suspected fed material. Annexis species are nematode and they cause the annexis, which is basically a round worm of a mammalian such like a walrus, dolphin. Infected larva form is found in the various type of the fishes in some Scandinavian countries and Japan. It is reported in the main it causes the intestinal colic, fever, intestinal obstruction. Diagnosis is made by the eating the fish infective of only endoscopic observation of the parasite and by the eating the history of intermediate host and by the help of a monoclonal antibody immunological detection is also possible. In immunoglobulin E is responsible in allergic reaction, which analysis also aid in the diagnosis of annexis. Ginestostoma spiriginum is a pink color strout worm found in the felines. Infection caused in the man by the eating the fishes, raw fish, uncooked. Gynestomosis interna is the symptom have the vomiting, urticaria and xenophilia. Gynestomosis externa, which is migration of intermediate subcutaneous oedema persistent as long as for 10 years, and they cause the cerebellar and ocular gynestomosis, and diagnosis is made by the biopsy tissues, skin test, adult gyneistoma antigen, Spiromota erinaceae are a tapeworm, sporinium in the larva stage of the various species of a Sporometra found in the canine and felines host eating the frog and snail. Infection in the men takes place by eating the raw frog by the Chinese custom of rubbing the raw frog in the eyes and ulcer, and the diagnosis is made by serological means, but also the Sporometra in the men it causes the painful swellings, and these swelling also aid in the diagnosis. Echinococcus granulosus are a tapeworm of the dog, which is a definitive host. In the definitive host, it come into the small intestine, and the egg is passed in the feces of definitive host, similar to the Taenia species, and these eggs are infective to the various animal, including the human. The sheep are intermediate host for this organism, just like a Taenia. It slowly develop into the hydatid cyst in the liver. It is 50%, followed by the lungs, which is 40%, and other organ like brain is 10%. Infection in the man is occurred by ingestion of the egg, and the cyst starts bigger enough to show the symptoms, and the diagnosis is made by the Casnios test and by detection of procolos in the hydatid cyst fluid. Detection of antibodies to cyst fluid antigen is also available, and this disease caused by the Echinococcus granulosus is called hydatidosis. Echinococcus multiocularis is smaller than Echinococcus granulosus. It is basically the intermediate and definitive host are foxes. Infection in the man is take place by the ingestion of the eggs. Parasitological diagnosis is difficult as procoloses are found rarely, but its metastatic nature is there, just like the Echinococcus granulosus.